Hello and welcome to Healthy India. I'm your host Lottie Alaric and I'm here with this special show wherein we talk about various health conditions. In our series of talking about health conditions, today we will be talking about oral health because our teeth are one of the most important parts of our body. But how to take care of them and how to last them for our whole life is something that we all need to work at. So to tell us more on the issue, I have in the studio three eminent doctors. I'm very happy to welcome Padma Shri Dr. Mahesh Verma, Principal, Director and Professor from Maulana Azad Institute of Dental Sciences. Thank you so much for joining us. Sitting next to him is Professor and Head Dr. Sunita Gupta, Department of Oral Medicine and Radiology, again from Maulana Azad. Thanks for joining us.
Thank you.
And we are also joined by Professor Dr. O.P. Kharbanda, Department of Orthodontics and Dentofacial Deformities, Center for Dental Education and Research, AIMS. I welcome you too, sir. Well, friends, before we start asking any questions to our panelists, let's all take a look at this report.
Oral health means more than just an attractive smile. It's a reflection and an essential part of total health. One who has bleeding gums or decaying teeth can hardly be called healthy. Oral health refers to the condition of teeth, gums and the mouth as a whole. In our country, unfortunately, oral health is at a discount. Vast segments of our population suffer from tooth decay, gingivitis, periodontitis, pyorrhea and even mouth cancer. Accumulation of plaque and tartar around the gums often go unnoticed and lead to painful conditions later. Many systematic disorders have been identified as contributory factors, as has also been the role of certain classes of drugs that lead to or aggravate gingivitis and periodontitis. And then there is a role of the things we eat. It is recognized that starchy foods, sugars, soft foods and refined foods also predispose one to dental ailments. Perhaps a little more care in this regard and a little attention to oral hygiene, regular brushing of the teeth and visits to the dentist could go a long way in ensuring that our breath remain fresh and our smiles captivating.
Well, so right at the onset, let's try and find out from Dr. Mahesh Verma as to why is oral hygiene so important for all of us?
There are many reasons. Oral health is not just, I think the first and foremost is the sense of well-being. We usually see, a lot of people doing everything which is bringing them back into the health, fitness. They have healthy food, they have, they do exercise, but as long as their mouth is not fine, the sense of well-being will never be there. So, the complete sense of well-being and freshness and feeling, the feel of healthy feeling will only come if your mouth is healthy.
Okay.
That's one. And then obviously, mouth is the door for our entire health. It's a gateway. And if your gateway is not fine, and it's also very peculiar situation that you see our gums, where all the blood is in direct contact with the with the oral cavity, and if the gums are diseased, the billions of bacteria which are always there in the mouth can have a direct access to the blood and to all parts of the body. So, it is not only just teeth, gums and bone alone, but also so much health at stake if the oral health is not fine.
That's right. So, you really put it all in perspective. So, Dr. Sunita, what is the best and the best way really to keep our oral cavity really healthy?
I think the dental health is, one which is preventable. That's the best part of it. It's the beauty of it.
Yes.
So, if we take small little tips and, care about it, I think it lasts with us for lifetime. For example, when the child is born, from that point onwards, just cleaning the small little, tooth which has erupted in the lower incisors, for example, cleaning with a little moist cloth, soft cloth. going for those applications of fluorides when the teeth are in place and sealing them, which we call it as a plastic filling material, for example, to, of course, the routine processes of brushing twice a day, rinsing the mouth regularly, not having, snacking in between the meals, flossing as well, and cleaning the tongue, which is like, So I think these are some of those aspects which can really, take a long way to really keep the oral cavity very, very healthy. Yeah.
Right. So, Dr. Kharbanda, are there any do's and don'ts about the way we all brush?
Yes, of course, there are. And most people think that brushing is like you just, like even if you walk, there is a way to walk it. So similarly, brushing, to be effective brushing, there is a way to do it.
Okay.
And it really starts with how old you are.
Okay.
If you are a small kid, you need a smaller brush, softer brush. If you are an adult, you still need a brush which is adult size, but with a small head. If you are like an aged person who has spaces between the teeth, so you need a brush and you need another brush, which is called interdental brush. And if you are wearing dentures, you need a special brush to clean your dentures, that is called denture brush. And similarly, you need different kind of paste at different ages. So like if you are a child below 4 years, we recommend not to take a toothpaste with high fluoride, because you don't have a reflex to spit it out, and extra fluoride can be harmful. When you have developed good spitting reflex, you can, and if you have very high tendency for dental caries, you should be using a toothbrush with high fluoride content. If you are adult who has lot of pyorrhea, then you should be brushing and flossing, and also you should be using a toothpaste which has anti-plaque agents. So selection of a brush can be done with the advice of a dentist as well. And then of course it has to be an effective brushing, which means that you should be able to clean all nooks and corners of your teeth, which are many in the mouth. And in addition to that, we should also take care of the oral cavity, which is the cleaning of your tongue, coughing it out, any sputum or anything which you are left in the throat, and of course blowing, which means that giving health to your cheeks. So it's everything. So oral cavity has cheeks, it has oral, and then you have mouth, tongue. So everything needs to be cleaned.
Right. Now, talking of toothpaste, Dr. Verma, these days, there's a galore of toothpaste out there in the market, and each one of them advertise that they are better than the other. Now, for the gullible consumer, it's very difficult to understand as to what is going to be good for him or her. Specifically, these days, there's a lot of talk about sensitive teeth, and so these are the pastes that you must use. So how should a common person really be able to decipher among all these?
I think, see, one thing we need to understand that, most of the standard products, they're very similar.
Right.
These are value additions, and these are marketing, gimmicks. And, you see it's not only in the field of dentifrices, toothpaste industry. I think it is everywhere. We have all kinds of watches, we have all kinds, it's everywhere. So, every manufacturer tries to woo the consumer. When I say standard product, we say it is a standard company, a good company, which a good background. I mean, there could be small scale industry who's producing a toothpaste not in the right conditions, whose contents are not fine. What does a toothpaste has? It has a dentifrice, which is kind of a very mild abrasive. It has a binder, it has a humectant, because it has to remain soft and moist throughout, and it has some flavoring agents which makes you gives you a nice feeling. So things like that. The only thing we have to ensure that it is a standard product. You talked about products which has got certain value additions like whitening.
Yes, so these days there's a lot of talk about that.
They may have certain chemicals which can just it's like a bleach, like we bleach our bleach our
Clothes.
we put a little bleach. So it has a similar chemicals in a very milder form.
So are these pastes safe to use really?
Yes, they are. Most of it, they have to go through a certification. Some of them are, some of them are certified by because I think toothpaste comes under Cosmetics, Drugs and Cosmetic Act. So I think they also have certain standards. Then there are toothpaste which are these days which are being talked about is toothpaste against sensitivity. So they also have certain chemicals because you see the sensitivity could be for many multiple reasons.
Right.
And it has been seen that these days for many reasons, for multiple reasons, this problem, this complaint of sensitivity is quite common and you come across patient quite often. So they have certain chemical. Of course, sensitivity has to be handled after examination by different ways, but many a times we do also, professionals also, we prescribe these medicated toothpaste to take care of generalized sensitivity, which is all over if the teeth are worn out and the deeper and the sensitive portion of the teeth is exposed in the mouth. So these chemicals will slowly desensitize or stall the sensitivity. So basically a good toothpaste, and of course the most vital is toothpaste with fluorides, as Professor Kharbanda just told you, that beyond 4 years when the spitting reflex is in place, we should utilize toothpaste with fluoride because it's known world over that local fluorides are very good for teeth. In fact, there's a myth that fluoride toothpaste are not good, and our water has fluoride, so we should not be using fluoride. I think that's all a myth. In fact, all over the world, it's the fluoride toothpaste which has brought down the dental caries tremendously.
Okay, well, so that's a good message for the people out there that if your toothpaste do contain fluorides, that means you're on the right track. Now, Dr. Sunita, we find that a very common issue with many people is the formation of plaque behind the teeth. Now, first of all, why is plaque formed and how often should it be removed? And if it does not get removed, then what is the next step? Are there any dangers associated with it?
It's a very good question, Lottie, that you put forward to. Plaque is nothing but it's a kind of a thin plastic film which forms on the surface of the tooth, because we have the hardest structure of the body, we call it as an enamel. But if it has not been taken care for, even that gets affected around. So this plaque, when you eat, drink anything, it just forms within 10 to 15 minutes time. And this plaque has lot of bacteria in it. Now the problem lies is that if you take any carbohydrate or sugar food, this sugar it reacts with this bacteria and it forms some acids, and this acid in turn it keeps on hammering around on the toughest structure of the body, which is the enamel, this is the surface of the tooth, and then they start deteriorating, or it starts forming little cavities over the period of time when if it's not removed on the right time. So basically, when it forms or when you eat or drink anything, I mean, the best thing is to use a neutral kind of, for example, water. Just take it and rinse it out so that, there's no accumulation of food, there's no accumulation of any kind of, fermentable food which is there, which will react with it. So it will make it still, safe for us. At the same time, when this happens, we have saliva which helps us out, as Professor Mahesh Verma said about it, that we have the fluorides which helps in turn to, whatever the destruction has happened, to seal it out at the same time. So after a while, if it has not been removed by a good brushing habit, for example, in that case we need to, we use mouthwashes. So thereafter a regular, cleaning by the dentist, which is every 6 months it has to be done, and frequent visits. If still it forms the accumulation of, happens, then it forms which we call it as a calculus thereafter. So which means that people must keep visiting the dentist regularly. Only then can these things really be taken care of. Absolutely.
Right. Well, folks, so there it is, that oral hygiene is very important. The way you brush, the kinds of paste that you use, and the formation of plaque, you must understand whenever it is there, you need to get it removed professionally. So keep all those points in mind. While we slip into a very short break, when we come back, we'll be taking this forward and we'll try and ask Dr. Kharbanda as to why is it that certain people have more sensitive gums than the others and what should be done in such a case. So don't go away, as we'll be seeing you on the other side. Welcome back. This is Healthy India, and today we are talking about oral health. So, Dr. Kharbanda, as I said, that many people they find that sometimes when they are brushing, they find that there's blood in when they are spitting it out. So, does that mean that these people have sensitive gums, or could the problem be something else?
Yeah, actually, this is a very first sign of the gum disease.
Okay.
What a layman calls it pyrrhia, and it starts with gingivitis.
Okay.
And gingivitis is you can say, the earliest form of inflammation, and this is the major cause of tooth loss in our country. Because Indians are known to have, bad smelling mouth, which is an indication that you have pus in your mouth, and it is a pyrrhia. So if you get like if you bite on an apple or something, and if you spit and you get some blood there, or there could be many reasons, but most of the cases reasons is the mouth. There could be more reasons from the lungs and other things, and GIT as well, but they are not as common as the dental reasons. And if it is not checked at this stage, if it is not treated, because it is reversible, when it is very mild gingivitis, it is reversible. And reversible means that you don't lose the attachment of the gums over the teeth, because when the gums are firm, they don't bleed. When they are swollen, they are like, if you say that, if you compare like an orange peel with a tomato. So the healthy gums are like orange peel, they are rough, and the tomato is like shiny and red, and that is the not good thing to have. That's how it is.
Right. Now, Dr. Mahesh, so if somebody has sensitive gums or pyrrhia, as he said, so what is to be done? Because if someone really does not go at that point when it is reversible, then what happens? What is the next, stage of treatment?
I'll take it forward what Professor Kharbanda said, that see, mostly what happens that why the gums, they bleed. We bleed because there are certain deposits. We've not been able to look after oral hygiene, and deposits are local irritants. I'll tell you, and then when there's a local irritation, what happens? The tissue swells up. Like when you get an injury, what happens to your tissue? Tissue swells up, it becomes red.
Yes.
And if you manipulate, that tissue can bleed. So something very similar happens in the mouth.
Right.
So bleeding is one of the earlier signs, as Professor Kharbanda said. Now, what happens that most of us, our attitude is lackadaisical. We just are laid back, and we say, okay,
because it doesn't look like an emergency to us.
What we do? Most of us, we stop brushing. We don't brush because so that it doesn't bleed. We try to hide it, we try to suppress it, but it is actually body's reaction, body's first sign to you that something is wrong. Let's get it corrected. So if suppose it is not taken care of, what happens? Something more serious will happen. What happens? Your infection, your inflammation, which is just restricted to gums, will go deep down into the deeper tissues of the teeth, which is holding onto the bone, and then bone, still on, if still neglected, then the bone is involved. So, entire complex gets involved, and what happens when there is a infection and inflammation, the bone gets resorbed. And please viewers, please remember that once a bone is lost, it can never be regenerated. It's lost forever. And that is why you see what happens, that over the years the same teeth become loose, mobile, shaky, and then we have to lose the teeth. As Dr. Kharbanda said, this is the biggest cause of tooth loss in our country, and even other parts of the world. So first sign which body is telling you, I think we need to take note of it, and we need to take corrective measures at our own level and at a professional level.
Then at a professional level. Well, okay, that's so now I think the next step would be caries, dental cavities that many people would sometimes have and not really think too much about, or unless it really starts to hurt. So why do these dental caries really happen, Dr. Sunita?
Lottie, I told you earlier when you asked about the plaque formation, and we have the acid, which forms. So the pH, basically, the lower the pH, the more is the acid, product, which is, or the product which forms here, and then it starts hitting the tooth surface, and then it forms the caries there. Now, if you keep on having some food which are like, with a neutral pH or a higher pH. Now, for example, walnut has, 8.6 pH value, or maybe carrot has 9.6. So these are the pH, which will try to cut the acid part of it, and it will try to neutralize it, because when there's more acid production, so we have to neutralize it so that the cavities do not form here. When the caries happen, it starts with a little depigmented kind of formation there, which might not really form a hole there, but it might just form a little small discoloration on the tooth structure. And specifically in the areas which is the biting surfaces and between the tooth, where the two teeth they come in contact. So these are the areas which are very, very prone, because bacteria can really multiply there, and then they can attack there. So when this forms, and thereafter there will be a time when it goes deeper down the enamel layer, then the dentine is very sensitive. So you start getting, when you have sweet food, cold food, or water or something, it will start hurting in that area. When it still goes down deeper down in the pulp tissue, it reaches the nerve supply, from where we get the nerves, then again it becomes sensitive to hot as well. So sensitivity to hot and cold, of course to sweet, and a little air, then you get little swellings and things like that thereafter. So the management has to go depending upon how the caries have formed, at what level.
At what level, all right. So what would those levels really be, if you can just quickly tell us? Suppose someone comes to you when not much harm has been done.
Yeah, if it is not much of harm, then we can put some plastic filling, for children, for example, when the first molars, they erupt at the age of 6 years. So we can really, with the biting surfaces, to make, because we have small mountain kind of ridges on the surface of the tooth, so the food gets lodged there very fast for these children. So we can make that flat so that they can clean it easily, which is a fluoride based kind of sealants, we call it as Pitt & Fisher sealants. We can go for some regular application of fluorides, what we have understood till now, the use of it at the same time. Brushing our teeth regularly at this, periodically, morning and night, of course. So the classification, there is other thing which we call it as a nursing bottle caries, for example. There are some mothers, who put the feeder in the child's mouth, and this, they make them sleep, over the period of time at night. So the accumulation of the sweet milk which is there, or beverage what they put inside that bottle, it induces the rampant caries formation all over on the cavity, on the tooth structure. So which should never be done about it.
Right. Now, Dr. Kharbanda, in our country, we find many people in the habit of chewing some kind of tobacco. Different forms, but there are people who would chew them. And of course, discoloration is the first thing that you would see visibly. But what are the dangers of actually using tobacco to the teeth particularly?
In our country, we have a tobacco which is with the smoke, and there is another one which is without smoke. So both are harmful.
Right.
But the one without smoke, which is taken like in contact, like we take pan, we take some kind of masalas in it, and then some people add tobacco to it, and then tobacco is also of different strength. Somebody says that I take 600 number tobacco means I am very strong man, but it's other way around.
Right.
The more the harmful it is to the oral cavity. Now, all these things together, like they produce some substances which we call them carcinogenic.
Right.
Means they can cause cancer to the mouth.
Cancer forming.
But short of that, what happens that the first thing they do it that they discolor your teeth. So they don't look nice.
That's right.
That's why they are ugly. And then these also cause more deposits. That means you have more chances of gum recession and bone loss and mobility. And there are situations when like a tooth has a calculus deposit on it which is bigger than the tooth itself. We have faced some situations and causing halitosis and pus discharge. And also these are the people who have eat a lot, they don't brush, and they are also sometimes malnourished. So,
Yes.
all these combination, and in addition to that, if you are also taking alcohol, so it is like adding fuel to the
Fuel
fire,
to fire.
and this brings certain changes in the mouth. And initially the changes in the mouth are like the mucosa of this mouth starts becoming harder, and there is a condition which is like more common in the people, especially with young children now. They are more into this smokeless tobacco, because smoking is considered a little bit socially
Yes.
not acceptable.
Correct.
So they revert to smokeless tobacco or smokeless other things which they chew, and these cause a situation which is called submucous fibrosis, where your skin or the muscles become hard and the mouth opening starts slowing down. So this is a dangerous situation. It's a precancerous. Now there are other precancerous conditions in the mouth which we usually see in the form of a white plaque
Okay.
and sometimes a red plaque. So we call it leukoplakia and erythroplakia. And scientifically the erythroplakia, red patch, is much more dangerous
Okay.
than the white patch.
Than the white patch.
So if anybody has a ulcer in the mouth and it is not healing, he has a patch, or red patch or white patch, I think it is the time a professional has to be consulted, because we have the highest incidence of the oral cancer in the world. So we are the cancer producing country for the oral cavity. Yeah.
Right. So, Dr. Mahesh, do you want to add anything to this?
I think he's put it forward very nicely. But see, I only want to say that using pan masalas and snuff, some of these naswar, some of our they use tobacco in various forms.
Yes.
Kivam and all those things. Zarda, all those things. These are very subtle and form of. I mean, people may not feel that they are consuming something harmful, but over the years, when it happens for a prolonged period, it could be disastrous.
Right. Well, so folks, I think the point is clear that tobacco in any form, whether it is a smoky form or a non-smoking form, it is going to harm you. And not only your teeth, your oral cavity, you could also suffer from cancer. So do take the doctor's advice here carefully. Well, it's time for us to slip into yet another break. When we come back, we'll be taking this discussion forward. So don't go away, as I'll see you on the other side.